So our practice is pretty eclectic, and our patients really appreciate that because we offer a lot of different types of modalities. So most of the practice is family-based, and so we see everything from newborns all the way to those in their elder years, and kind of everybody in between. But beyond that, the practice has been here for 5 years. I've been in practice for almost 12. And in that way, my practice has moved, ebbed and flowed a little bit depending on the type of patients that we've seen. For a long time, it's been a lot of hormone replacement, hormone balancing, menopausal, premenopausal women, men with hormone imbalances as well, testosterone problems, and then a lot of folks with thyroid dysfunction. So this is where we'll oftentimes move away from prescription medications and towards those alternative modalities. Those are things like acupuncture, prolotherapy, platelet therapy. We'll often also use supplementation, counseling, nutrition. And a lot of these, when they're used together, can give you much more improved outcomes for patients with a lot less side effects. So this is a model of your knee. Obviously the skin's been removed, but we can see down to the bone structures where we're actually almost getting inside the joint. So this is actually your femur or your thigh bone. This is your shin bone. So you can see as the knee is bending, so you can get a good look at the menisci that are inside here. And if we turn to the back side of the knee, you can get a good view of the ligaments that are here in the knee. You got the collateral ligaments on the sides, and then you got the ACL and the MCL here inside of the joint itself. So today what we're going to do is we're going to actually, on the outside of course, we're going to clean a little bit of the area with some alcohol. And then I'm going to then use a topical spray to kind of use a coolant effect so that it actually numbs the skin so you don't feel a whole lot. And then using my needle, have you look away. I'll look away too. Just kidding. And then we can actually insert the needles here, insert the fluid, kind of aiming down towards where your problem is around the ACL in the hopes that we can then try to build those new tissues. In addition, the practice offers intravenous therapy. So we'll give you a quick example. So you come in, unfortunately, with a cold, and most of the time you have to kind of let it run its course. There's great data out there to suggest that vitamin C, as one example, can significantly shorten the duration of a cold. The problem is you can only tolerate a certain amount orally. If you go too much than that, you're going to end up getting a little bit of digestive upset. If you are to actually infuse the vitamin C, in other words through the venous system, you can typically go 5, 10, sometimes 50 times higher because you're bypassing the digestive system altogether and going right into the circulation that way. The practice also, of course, has a very eclectic mix in our medicine area where we have a lot of different kinds of supplements. Everything from conventional multiple vitamins to fish oils that a lot of folks are familiar with to sort of more obscure things to treat very specific conditions from digestive issues, headaches, and pain. So along with pain management comes acupuncture. This is a tried and true modality that's been around for nearly 3,000 years. So here's an example of an acupuncture needle. It's about the width of a human hair, and we're going to put 4 different needles in today. 3 things can happen when you put the needle in. 1, which is the most common, you feel nothing, so small. Number 2 is you'll feel a little poke. It is a needle after all. And number 3 is you might feel a little bit of a sharp pain. It's really rare, but if it does happen, we'll just take it out and put another one in. We oftentimes will marry acupuncture with either prolotherapy or PRP in addition to any other kind of modality we find is necessary to help people with their pain. So in that way, patients are really pleased with the practice in a way that they don't need to come in just for their cold and flu, but they can also come in if they have a pain issue, if they have another problem with their children, if they have some other issues with their spouse, we can often help there as well. So it's a great way to kind of get everything done all in one place.